My name is Weston Davis, and I am 60 years old. Will be 61 in about a month and a half. I live in San Antonio, Texas. I thought I had a muscle pull in my chest over here on the left side of my chest. And from moving stuff back and forth on top of counters like coffee brewers and stuff like that, they're usually heavy, so sometimes I'll pull a muscle in my chest. That's what I thought I had. And it went on for about 2 or 3 days, and then I got some other symptoms that my daughter had told me to go get a COVID test just in case, to make sure. Had some fever and some chills, and so that Monday, following Monday, I went to Texas Med Clinic up here close to where I live to get a COVID test, which was negative. And they wanted to test me for strep throat since that's what's going around also. So the doctor left the room and came back in, and I turned around to greet her again, and I just kind of fell on the floor. I passed out and couldn't breathe, and I don't remember much when I fell on the ground. I remember they got me up onto a gurney, to a bed, and then the doctor called 911, and before I knew it, I was in an ambulance on my way to University Hospital. They told me what had happened, that I needed a Impella device put in. I do know that's what I had to have to save my life. I had just about the best care anybody could ever have there, with the ICU nurses and techs, and my cardiac doctors, Dr. Carpenter, Dr. Anderson, Dr. Prasad, and their teams. They came to see me throughout the days, every day. Had nothing but great care at this hospital. I was very lucky, very fortunate. I felt very, very comfortable where I was. And basically, I've had nothing but good experiences with the University Health System ever since my heart attack. I do want to thank the ICU nurses and techs and staff at University Hospital. My cardiac teams were the best. They're the ones who saved my life, and the ICU people saved my life, kept me going every day, taking care of me, and I couldn't be more proud of those people. They're very, very, very good people. They're very professional with what they do, and I would tell anybody to go there if they're sick. They're just the greatest people that I've ever known. So they saved my life, and they kept me alive, and I'm home. This is where I'm at right now. I feel a lot better. Recovering very well. I am heart recovery because I am able to be home and do things on my own again. I go to my grandson's sporting events, play with my little grandson, which is still the baby. I'm able to do some yard work, maybe a little too much here and there, but I'm able to do it. I love it. And I believe I'm going to be in much better shape now than I was before my heart attack. Thank you all for saving my life.